Hello, and welcome to OBGYN Made Easy. I'm a board certified OBGYN. I have a background experience in the United Kingdom.
Magnificent.
Before I moved to Texas, where I finished my residency. Hey y'all! And currently I'm practicing in California. If you're a student, a resident, or somebody who wants to know about OBGYN in a very simplified way, you've come to the right place. I believe in a very simple fact, is that if learning is not fun, you won't memorize it at all. So let's have some fun and jump right into it.
In a previous video, I covered the management of preterm labor. In this video, I will cover the prevention of preterm labor. Let's assume that a patient comes into the office for a new OB visit and she gives a history of preterm delivery in a previous pregnancy. History of preterm delivery is a risk factor for recurrence, so how do we reduce that risk? And the answer is by giving weekly intramuscular progesterone called 17-alpha-hydroxyprogesterone caproate, starting at 16 weeks through 36 to 37 weeks. In addition, an ultrasound should be performed to assess the length of the cervix, starting at 16 weeks, every 1 to 4 weeks until 24 weeks. If the cervical length is found to be less than 25 mm, then a cervical cerclage is indicated. This is a good place to talk about cervical cerclage. A cerclage procedure involves inserting a suture around the cervix to keep it closed. It can be done vaginally or abdominally. Explaining the procedure is beyond the scope of this video, but it's important to understand the indications for it. Those are ultrasound, history, and examination indicated cerclages, and we will talk about each in details. The first one is ultrasound indicated. Like the example we talked about previously, the patient has to have a history of preterm delivery and a cervical length of less than 25 mm before 24 weeks of gestation. The second one is history indicated cervical cerclage. This includes a history of a second trimester painless cervical dilation or a history of previous cervical cerclage. The last one is examination indicated, where on examination the cervix is dilated to 2 cm or more. This type is also called emergency or rescue cerclage. It's important to understand that if the ultrasound shows a short cervix without a history of preterm delivery, the management includes giving vaginal progesterone rather than inserting a cerclage. Unfortunately, none of the interventions that I mentioned reduce the risk of preterm delivery in the context of multifetal gestation. The cerclage should be removed at the time of an elective cesarean section if the patient goes into labor or at 37 weeks of gestation.
If you want to support this channel, please like and subscribe. If you have any question or any suggestions, please leave them in the comments below and I will do my best to address them. Guys, my commitment to you is to provide you with the latest information based on the most recent American College of Obstetrics and Gynecology guidelines. Thank you and see you next time.